here I said, what was your connection with Anderson Island? When did you come on the island? New Year's Eve, there was a party at Anderson House, and Myrna Reich and the sculptor, what was it, Ed Falkenberg, were there. And Ed said, buy 2 lots. And they were $15,000 at that time. Now you can get them for 3, I think. So that's, and my date was Bob Riggle, who was a horse vet. And we were dating, and then he took up, he used to play polo at the Roy Y. And then he took up sailing. And he went to the Middle East with 2 other people from Seattle, and the Somali pirates boarded his sailboat and killed them all 3. So are you recording all this now? Oh, I didn't know that. Okay. But the second thing, what prompted me to join the services and did have preference of a particular branch, well, my dad was in the Army Signal Corps, head of the motion picture school in World War II, and filmed Yalta, Malta, Potsdam, and the signing of the Japanese surrender, and brought the film back to the United States. And as they were siphoning gas on the tarmac to fill their plane up to fly back, a Japanese taxi came driving up, and they had heat of their vehicle by a lit hibachi grill. So my father grabbed the film bag, ditty bag of film, and ran across the tarmac so it wouldn't blow up. But eventually they got the film here of the signing of the Japanese surrender. And as far as Army goes, I had been trained at St. Jude's in Children's Cancer and started the programs. When I left college, first one to go to college in the family, and my dad wasn't sure why girls should go to college, so I got a work scholarship in biology at Florida Southern in Lakeland, Florida, which is in the middle of an orange and avocado lime grove designed by Frank Lloyd Wright. And so I worked that. I became a student senator at that time, and also played varsity basketball for Florida Southern. And still one of my classmates, I was dream girl of Pi Kappa Alpha. His mom passed away, and he set up a Charlene P. Holt pre-med scholarship in my name. And so I contribute to that every year. And then I got a letter about the basketball team needing new uniforms, so I added a little bit. And now I've got a Florida Southern basketball team jersey to wear. But those were good years at Florida Southern. And in those days, when I applied to medical school at Miami, you could use your senior year in biology. Florida Southern gave you credit for your 4th year of college by going to med school for 1 year. In my interview with the dean of the medical school, he asked me if I was coming to med school to catch a husband. And I said, no, sir, there are a lot easier ways to do that. And at that time, there were 4 girls and 80 guys in the class. And a friend of mine named Rudy Holton from Southern came up to go to med school and had appendicitis. And so I helped him catch up with his work. We started to date. We got married before the pill, so I had 2 girls, Dana and Stephanie, while I was a medical student, so it was sort of on-the-job training. And of course, we had quite a few jokes pulled on the ladies in the class by the guys, but it was all okay. We also endured the Cuban crisis when Castro had his missiles pointed at Miami, and the medical students and faculty helped with all the problems. And there was so much disease, TB, VD, the broken bones, and no one was immunized that coming into Miami. And it's amazing how we face some of the similar problems now, unfortunately, on our western border. But the experience from Miami I went back to Memphis after I graduated with an MD to train at St. Jude's Children's Hospital, Cancer Hospital, and was there also because I had 2 children and I had family to help me take care of them. My kids were there, but unfortunately in 1969 they assassinated Martin Luther King, and we were under martial law at that time in Memphis, and I got an offer from Denver Children's Hospital to start a children's cancer program, and they gave me a wing of the hospital. So I piled up the kids and the dogs and went to Denver, and at that point in time we were working with the University of Colorado, so I had an appointment to the med school as well. But the Army Fitzsimmons Hospital was in the area or near the hospital, and they were sending me pediatric residents to train as fellows in pediatric oncology. So that was my first really encounter with the Army in Denver, that I thought about things differently, not to mention my dad being in the military in World War II, and he's now in the New Orleans World War II Museum. After that, I remarried a Dick Holt. So I went from Holton, who passed away with a GI cancer, the kid's father, to a Dick Holt, who had been sort of a Green Beret SEAL kind of guy, and had jumped out of airplanes and ate snakes and did all that stuff. And he decided he wanted to be a wheat farmer. So we moved to Idaho, and Governor Love at that time wanted a children's cancer program. And so while we set up a 500-acre wheat farm and stuff and remodeled old farmhouses, I was commuting to Boise to start at the Mountain States Tumor Institute, the children's program. And that 80-mile commute got kind of old, so we decided that we would have a clinic in Weiser, which was the name of the town that the ranch was in. And so I brought some pictures to show that little clinic, and we were treating not only children but adults with cancer, because of the trip. It was a long trip. Then I was put on the hospital staff at that time. So that's Idaho. Well, we had, after a long, hard time of trying to make money on a wheat farm in Idaho, Dick and I moved out to Graham and sold the farm. And in Graham, Washington, it was, brought the horses and the dogs and all the pets and the kids. And the kids went to the school in that area. And I would drive by this encampment going to town, which is a bunch of old buildings, and it happened to be that I called the consultant in pediatric oncology, or just general pediatrics, Jim Bass, and said, "What is that building?" And he said, "Why do you want to know?" I said, "Well, we moved out there." And he said, "Oh, we need a children's cancer program at Madigan." And so I said, "How do I do that?" It was 1978. I was 40 years old. And so I decided that I would do that. And I learned to repel at 46, And they brought me in as a light colonel and said I'd get to go to Fort Sam to learn how to be a soldier. But the commander of the hospital at that time said we're short-handed. So I watched movies of how to be a soldier and an officer for the first time. And unfortunately, when I would go to the commissary or PX, I was saluting first to enlisted, which I was told later was not the right thing to do, and I learned. The other thing that happened while I was there was in 1980, Mount St. Helens blew up, and I was injured at that time and went to the neurosurgery unit, and I had a concussion, but also the next morning when I had to go potty, I got up and I couldn't walk because I'd torn an anterior cruciate and a medial collateral in my leg, so I had knee surgery at that time at Madigan. Then my husband, Dick Holt's parents were in Panama, and it was about the time Jimmy Carter gave away the canal. And nobody was happy, and his mom was Panamanian, and his dad was a pilot on the canal. So I put in to go to Panama and was at Gorgas Army Hospital in Panama, and my job was to try and transfer American patients back, depending on their diseases, to the proper military hospitals in the United States. And that was from 91 to 92, and I did jungle warfare school and 2 weeks in the jungle, and if you're lost in the jungle, you eat what the monkeys eat. And so I learned a lot, but I had a lot of sun exposure during that time. Some of the folks I met at Gorgas were going to the Middle East to work, and so at that time I became an OCONUS reservist out of continental United States and took a job in the United Arab Emirates. And the job was to work directly with the Minister of Health to look at the cancer problem in the United Arab Emirates and to set up a cancer program. I went to a hospital in Al Ain, in Tuam Hospital, and started that program, and they gave me a wing of the hospital. And unfortunately, there was a lot of skin cancer. They smoked quat and head and neck cancer and GI cancers. And the ladies I saw with breast cancer usually had the tumor breaking through the chest wall in an advanced stage. Unfortunately, the husbands usually would just get another wife. And so it was really a challenging experience. I was treated very well, and people, tried to help the locals to start that program. We ended up trying to make it at other hospitals in other cities in the Arab world. So we had Al Ain, Dubai, and actually went into Saudi Arabia to Riyadh to speak to their docs, and also to Oman to speak with the Sultan of Oman. There's an interesting story about him. His young son was not happy to some of the things that he was doing for the country, so he shot his daddy in the foot and took over the country, and things became a little more progressive for the patients in Oman. I then had an offer to come back to the States and do some work here, and so I came back to the States and ended up in Ohio working for Adria Laboratories, which developed some of the anti-cancer drugs. And my job then was to help them develop new anti-cancer drugs and help set up the clinical trials. And that was a lot of traveling. After that, I got the call from Madigan again, so I went back to Madigan, and after being in the Middle East and having to do 2 weeks in Germany, I didn't mention that at the time, of active duty, I would go and take a pediatrician's patients so he could go visit his family. So I had fatigues and dress uniforms and everything in my luggage in the Middle East, and I think at times they thought I must be a spy or something, but I wasn't. So when I went, and I think it was 1984, to one of the German hospitals, and I'm trying to remember exactly which one, I think it's in my CV, the kids would meet me in Germany, and we'd do some traveling in Europe. And I walked in and the general said, "Congratulations." And I said, "Sir, what for? He said, you don't know? And I said, no what? He said, you've been promoted to a full colonel. And I said, no, sir, I didn't know that. So that happened during that period of time. And I then came back to the States, and I was in, as I said, Ohio, and also back to the Tacoma area, and started working again on a second tour from Madigan. And this time we had, the new Madigan was being built, and they wanted a breast cancer program from 1991 to 98. I set up what was called the breast cancer pathway, in which the Army had actually developed a piece of equipment that was coming from gun sight technology that could put a needle directly in the tumor, which was more sophisticated than they had before. And so I was working with a Dr. Babu and a lady named Jenny Fuller and a surgeon named Preston Carter to do that. And we would try to get the patients in early, and then they had a breast cancer support group called GANTS. And I said, what does that stand for? If you'll excuse me, it's Girls Awaiting New Tits. And I thought, that's interesting. So we tried to change it to a little bit more broad type of thing, and we did that. But the connection with Madigan Old and New is close to my heart. I think it's an excellent, hard-working hospital. My main concern in today's world are they really getting the support that they need in all of our military hospitals? Not only the VA system, and I think that our current politicians have tried to help with that. I tried to go to some of the VA hospitals when I got back home, and you'd see a different doctor every time. And that's not good continuity of care. And so I ended up getting back to Madigan and starting the Madigan Foundation, which is I was bringing in research grants, but they didn't have a 501c3, and at that time the military had to spend all the money in 1 year, and that was impossible. So we did set up the foundation in 1995, which still exists, which I still contribute to, and that helped a lot with developing new programs, and the fact that I didn't have a Roth IRA. I've had to give required minimum distributions, but that's been a great service, I think, in my life to be able to do that, not only to Madigan, but to churches and the DAV and the American Legion and things like that, because I think that there's a lot of room for improvement in medicine and how we treat patients, and the continuity of care and the hands-on I still believe in. But I'm just delighted to live on Anderson Island, because I came out here in, I think it was 1995, for a New Year's Eve party. It was what was in a bed and breakfast at Anderson House, and with a bunch of folks that I knew from the mainland. And when I walked out on the porch, I said, this is Walden Pond. And it was just really pretty. And as I said, Ed Falkenberg was there, Myrna Reck was there, some pioneers. And I got to know Falkenberg quite a bit, because when I'd come out, I would sleep on his couch. And unfortunately, he developed some problems with cancer and passed away. But he was just a wonderful artistic creator, islander. So I bought the 2 lots in the Riv, which were a little bit more costly than they are now, and built a house that is Lindahl's cedar, but it wasn't the top of the line. It was a variation. And I bought them, again, I was told to buy the lot next door, which I did. And so I had the pleasure of watching the Riviera grow and change, and all kinds of different things have happened since then. But after that, I had my horse being boarded with a friend on the island, and the horse I bought was a Palomino in Amarillo, Texas, when I was down there setting up a children's program. And the Palomino turned gray, and then the Palomino turned white, and the Palomino started stumbling, and she went down in my front yard, and I had the vet come, and she had a malignant melanoma of her eye, so she passed away, and her two donkey companions stood by her side, and a friend on the island came out with a backhoe, and she's buried in my front yard at the Eckenstem Johnson place, along with a mama donkey that I bought for one of the companions, and I delivered her baby, cut the cord, got the iodine and everything, and I'd have two miniature donkeys that are my green lawnmowers, and that one was, I called my daddy and said, can I name this donkey after my mother, Juanita? Because she's feisty and cute, and Mom was the same way, and he said, okay. So I have Chocolate Chip and Juanita, my green lawnmowers at Eckenstem Johnson, that mow my yard, and I know when the coyotes are around because they get on the back porch. So I had many interesting experiences, and as far as memorable events on active duty is getting the chance to go to the Middle East and Panama, and to have 2 tours at Madigan, which I've certainly appreciated the company, and fellow service members, Dr. Bertie Mittermeier, who was the Surgeon General. I briefed him at Madigan, never knowing I'd run into him again in Texas, and he helped with the children's cancer program, and I got a better breast program going down there too. And as far as family support, and the other general that I'm very fond of is Les Berger. So when I came back, he was the commander of Madigan. He's been very supportive of all the activities, and that's also by setting up the foundation, we were able to bring in quite a few research grants. I believe, I haven't the exact numbers, but almost 2 million to the institution. And so 2 generals are friends, but a lot of them enlisted, and nurses and technicians are also friends. As far as family support, I had the 2 babies while I was a medical student, so that was OJT. And they have gone all over the world, and I went all over the world. And they were born in 1961 and 63. And they have, one of them is living in Seattle, and one of them is unfortunately she has a broken ankle right now. But the other one is in Allen, and is a oyster farmer, and her husband has a little medical problem they're dealing with. But I think that they like Washington State as much as I do. And as far as support, they're coming down for my 82nd birthday on March 1st and 2nd. And they said, what kind of a cake you want? And I said, I want a pecan pie, and fried chicken. But anyway, anything else to contribute? Well, what worries me today is I think that the Army medical corps at least needs to have some help. And I picked up some literature according to statistics, and I brought it to share with you. one of the articles. They're an overload, and I think that the thing that personally affected me was the fact that I was always exposed to a lot of sunshine, and they didn't really have the sunscreen or the eyeglasses for the medical staff and other troops, and so I would go elsewhere for my eye and skin care. But I essentially have recently developed two basal cell carcinomas that were removed at Madigan from my left lower lid. And I'm trying to talk with the VA and Madigan about really emphasizing more of the skin and eye clinics because I think that there is a lot of sun exposure when you're out in the field. And hopefully that will happen in my lifetime.
Especially Iraq.
Amen.
Thank you very much.
Thank you very much.
For your contribution. And also, we appreciate the financial support you're giving to the American Legion. So,
well, as I said, never knowing that I would, when I was in high school in Miami, I would win the American Legion Award and get to go to Tallahassee, the capital of Florida, and go to Girl State. And I hope we can get someone on this island that we can send to Boy State and Girl State. And I sure never knew I was going to join the Army and do all those other things. But thank you.